So people with acne come in as young as 8 or 9. A lot of parents don't think that their child that young should be breaking out with acne starting at that age, but unfortunately nowadays we're seeing a lot of precocious puberty, the hormones and everything that's in our food. It's producing a generation of kids that are getting their periods earlier. So we see kids really young starting to get breakouts. So you kind of want to come in and start them on an acne routine to just get them situated on that from the beginning. So it can be as young as that. The most common age that people think they will break out is as a teenager, but that's actually not the most common age. The most common age range is a female, anywhere from 25 to 45. But those women come in and they're really mad about that. So they don't think they should have acne. They think that it's an issue that's not really acne or it's something else. And they don't know why they're dealing with acne and wrinkles at the same time. They think it shouldn't be happening, but that is actually the age that I see more of, and it has to do with testosterone. Acne is testosterone and genetics. It's hormones and genetics. That is the reason why people get acne. So whether you're 8 or whether you're 45 and all ranges in between, people can have problems with breakouts. So we just treat depending on the type of breakouts that are happening to you at that time in your life. Treatments should start when it begins to be uncomfortable for you, or that you start to put more makeup on than you really should. When you're looking in the mirror and you're saying, oh, not another pimple. Come in as early as you like to start on a skincare routine. We don't want people to wait too long. If people wait until they've had a lot of acne, especially the red acne, and they've had it for a couple years, you're gonna have discoloration, color changes in the skin, scarring, anything like that sometimes can be permanent with the scarring, so you don't want to wait too long. So start as early as possible, and whenever it starts to bother you, come on in, and especially if your kids start to say something to you about it, bring them on in. There's lots of stuff that we can get started with. So there are certain oral medications that are given for acne. Antibiotics are commonly given, specifically tetracycline, minocycline, doxycycline, erythromycin. Antibiotics are common when people have inflammatory acne, meaning the larger acne, the deeper acne, pus-filled, the ones that are larger and the ones that leave more of a red mark. But antibiotics are only given for a short amount of time that is appropriate. I see a lot of people coming in from other practices or maybe older providers who haven't changed to the new way of doing things that are on antibiotics for a year, 2 years. It's not appropriate to be on an antibiotic that long. Sometimes even when I say 3 months to be on an antibiotic, parents are kind of like, what? But actually, anywhere from 1 to 3 months is okay. That's normal because we're using specific antibiotics that are for acne. It's not like the antibiotics that we give you for when you have a sore throat. So anywhere from 1 to 3 months is appropriate, but you have to be using something else. You have to have a routine already in place with topical medicines or maybe a cleanser so that once you get off the antibiotic, then you stay clear. You maintain. You can't just take an antibiotic, clear up the acne, get off the antibiotic, you're going to start breaking out right again. So people need to be on a routine, even though people, for whatever reason, like to just take a pill and get rid of it. That's not how it's going to be treated. So antibiotics are only used short term because other than that, we worry about antibiotic resistance becoming an issue, and that's a big problem in medicine today. So we're very cognizant of that. People always ask, do I have large pores and can I get rid of them? No, you cannot get rid of them because you need your pores. They're anatomically supposed to be there. The pore is an opening where you also have an oil gland, you potentially have a hair follicle. You're supposed to have them. People think that they have larger pores than they do sometimes. I have people saying, the pore's on my nose, and I have to get real close to them to see even what the heck they're talking about. And their pores are small, so I don't even know. I think people get really too close to the mirror, have those 100-time mirrors. You need to back away from the mirror. But the pore can be tightened by using retinoid medicines, which are commonly given with acne, and also with the different procedures like microderms or chemical peels. So you can tighten the look of the pore, but you can't get rid of it totally. Common side effects of acne medicines are always going to be an irritation, especially in the first 2 to 3 weeks of using a medicine. But usually Usually after the first couple weeks, people acclimate to it, meaning it does go away, you get used to it. But the first couple weeks, some people don't have any side effects, fine. But a lot of people will have pinkiness to their skin or a little bit of redness to their skin, and even skin cell turnover, meaning the skin cells coming up to the surface and off. So you get skin peeling, dead skin, you know, you run your finger across your face and skin peels with it. We just tell people really to exfoliate gently that dead skin and then also to moisturize. But we always tell people what their routine should be. As soon as you get past those side effects, then you're just kind of on maintenance. But a lot of people won't get past those side effects and say, oh, I need a new medicine. If I give you a new medicine and that starts happening again, oh, I need a new medicine. You kind of can't think like that. You sort of have to get past the first couple weeks, and then you can kind of get on a maintenance mode with the medication. So you don't want to stop too fast. So that's pretty much normal for everybody, is a little bit of irritation in the first couple weeks. Everybody should use a moisturizer, but depending on whether you're oily or dry, most people are a combination, so it's kind of a different answer. But people who tend to be oily, you want to use an oil-free moisturizer and something that is a lotion. So it's thinner, it's not as thick. It's more water than it is oil. Someone who actually has dry skin should use a cream. So it's more oil than it is water. So something thicker. So even if people come in and say, oh, I have oily skin, I don't moisturize. Oil is different from hydrating the skin. So everybody needs to hydrate the skin, even if you have oil. A lot of people with oily skin do everything in their power to dry it out. I've heard lots of things over the years. Apple cider vinegar, alcohol wipes, astringents, witch hazel, you name it. But if you dry your skin out too much, you are going to make your oil gland think it needs to produce more oil, so you will actually be causing your own problem to come back again. So you will actually make the oil issue more of an issue by trying to dry it out too much. Don't irritate, don't dry it out, and you should moisturize just with a thinner moisturizer. Most acne medicines, some people say, oh, I started to see a difference within 3 days. Well, that's great if you did, but that's not normal. Most medications begin, and loosely I say begin to work in 2 to 6 weeks. At 12 weeks, and this is the primary endpoint for any study of any acne medicine, is the 12-week mark. That's where you should see anywhere from a 60 to an 80% improvement in acne. So you're not going to see a 60% improvement in acne in the first 2 weeks, in the first 4 weeks. If you see that, great, but that is not the norm. You have to kind of give it time. So people kind of always want this miracle drug. If I had it, I would have given it to you, obviously. So you have to give the medicines time. And especially with the red marks, if people are getting red pimples, the red pimples go away. Even if you never touched the pimple, never popped it, never did anything to it, it will still leave a red mark. That red mark will go away, but it'll fade away over time. That sometimes can take 6 to 8 months. So when we say 12 weeks, we say the active acne will be 60 to 80% improved. So we usually see people back at the 2-month mark just to make sure they're going in that direction and reiterate certain things in terms of their routine to keep them going. But it's not overnight, so you have to give all these medications some time.